Assalamu alaikum. Today we will review the VTE policy in the question and the answer formats. Let's begin. Question number 1. What is venous thromboembolism? Venous thromboembolism or VTE is a condition that includes both deep vein thrombosis or DVT and pulmonary embolism (PE). DVT occurs when a blood clot forms in a deep vein, typically in the legs, which can lead to pulmonary embolism if the clot travels to the lungs, blocking blood flow. VTE is a significant health concern because it can cause severe illness, disability, and even death if not promptly diagnosed and treated. Question 2. Why is VTE prevention crucial in hospital settings? VTE prevention is critical in hospitals because patients often have increased risk factors due to surgery, immobility, or underlying medical conditions. Effective VTE prevention reduces the risk of developing life-threatening clots and improves patient outcomes, reduces hospital stays, and decreases healthcare costs associated with treating VTE episodes. Question 3. What are the main risk factors for developing VTE? Key risk factors include surgery, especially orthopedic surgery, prolonged immobility, cancer, history of VTE, obesity, smoking, hormone therapy, and medical conditions like heart disease and inflammatory disorders. Identifying these risks early is essential for implementing appropriate prophylaxis measures. Question 4. How is VTE risk assessed in a hospitalized patients? VTE risk assessment involves evaluating a patient's medical history, current medical condition, and specific risk factors for VTE and bleeding. This assessment is typically done upon admission and reviewed by a senior clinician within 24 hours, with reassessments if the clinical situation changes. Question 5. What are the two main types of VTE prophylaxis? The two main types are pharmacological prophylaxis using medications like low molecular weight heparin to prevent clot formation. And the second type is the mechanical prophylaxis, such as anti-embolism stocking and intermittent pneumatic compression devices, which promote blood flow and prevent stasis. Question number 6. Why is it important to balance the benefits and risks when choosing VTE prophylaxis? So choosing the right prophylaxis involves balancing the risk of VTE against the potential for bleeding, especially with pharmacological methods. Tailoring the approach to each patient's specific risks and conditions ensures maximum protection against VTE while at the same time minimizing side effects and complications. Question 7. How does patient education contribute to VTE prevention? Educating patients about the risk of VTE, the importance of prophylaxis, and signs and symptoms of DVT and pulmonary embolism empowers them to participate in their care. Informed patients are more likely to adhere to prophylaxis, as well as reporting symptoms early and engage in activities that reduce their risk, such as mobilization. Question 8. What is the role of healthcare professionals in VTE prevention? Healthcare professionals are responsible for assessing VTE risk, implementing appropriate prophylaxis, educating patients, and monitoring for adverse effects or changes in the clinical status. Collaboration among physicians, nurses, pharmacists, and other team members is key to successful prevention and a better care. Question 9. How should VTE prophylaxis be adjusted during a patient's hospital stay? Prophylaxis should be adjusted based on ongoing risk assessments, changes in the clinical condition, and patient response to treatment. For example, pharmacological doses may be needed to modify or switch from mechanical to pharmacological prophylaxis, or vice versa might be warranted. And this is dependent on the change of patient condition, so reassessment with each change is important. Question 10. What are the signs and symptoms of DVT that patients should be educated about? Patients should be informed about symptoms such as swelling, pain, tenderness, and redness in the leg, which could indicate a DVT. Recognizing these early signs enables prompt evaluation and treatment to prevent complications like pulmonary embolism. Question 11. Why is collaboration among healthcare professionals is important in VTE prevention? Collaboration ensures a comprehensive approach to VTE prevention, combining different areas of expertise to assess risk accurately, implement prophylaxis effectively, and educate patients thoroughly. It also facilitates communication and continuity of care across different stages of patients' hospital journey. Question 12. What is the significance of continuous reassessment of VTE risk? Continuous reassessment allows healthcare providers to adapt prevention strategies to changing clinical conditions and emerging risks, ensuring that prophylaxis remains appropriate throughout the patient's hospital stay and beyond. Question 13. How do mechanical prophylaxis devices work to prevent VTE? Mechanical devices like anti-embolism stockings and intermittent pneumatic compression devices work by applying pressure to the legs. This improves venous return and reduces the blood stasis, thereby lowering the risk of clot formation. Question 14. What role does discharge planning play in VTE prevention? Effective discharge planning extends VTE prevention beyond the hospital setting, ensuring that patients continue appropriate prophylaxis and are aware of signs and symptoms of VTE, also ensuring that the patient know when to seek medical attention, reducing the risk of VTE after discharge. Question 15. Under what circumstances should a patient risk of VTE and bleeding be reassessed? Patients must have their risk of VTE and bleeding reassessed whenever their clinical situation changes. Changes in the patient condition can alter their risk profile, necessitating re-evaluation to ensure that their VTE prophylaxis plan remains appropriate. This dynamic approach to patient care ensures that preventive measures are always aligned with the current health status of the patient. Question 16. How should deviations from international guidance on VTE prophylaxis be handled? Any deviations from international guidance on VTE prophylaxis must be clearly explained to the patient and fully documented in the patient's medical record. This transparency is important for patient autonomy and informed consent, and thorough documentation is essential for legal and ethical reasons. It ensures accountability and provides a clear rationale for tailored approaches to patient care. Question 17. What information should patients receive regarding VTE during their hospital stay? Patients must be given written and verbal information on their risk of VTE, methods of prevention, and signs and symptoms of DVT and pulmonary embolism upon admission. This information should also be part of the discharge process and documented in the discharge plan. Educating patients about VTE enhances their understanding and engagement in their care, empowering them to participate in prevention and recognizing symptoms early should they arise. Question 18. Why is hospital-associated venous thromboembolism considered a significant patient safety concern? Hospital-associated VTE is identified as a major patient safety issue due to its high incidence and the serious consequences it can have on patient health, including increased morbidity and increased mortality and financial costs to healthcare systems. Scientific evidence supports the implementation of mandatory VTE prevention programs as critical measure to significantly reduce the incidence of VTE in hospitals, thereby improving patient outcome and reducing the healthcare cost. Which patient groups are covered under the VTE policy? The policy covers all adult patients, 18 years and older, admitted to the hospital, including surgical inpatients, medical inpatients, trauma inpatients, cancer inpatients, and patients undergoing long-term rehabilitation inside the hospital. Question 20. Are there any patient groups not covered by the VTE policy? Yes, the policy doesn't cover patients under the age of 18 years, patients attending the hospital as outpatients, patients presenting to emergency departments without admission, and elderly or immobile people cared for at home or in the residential care unless they are admitted to the hospital. Question 21. What are anti-embolism stockings and how do they help in VTE prevention? Anti-embolism stockings are specially designed stockings that provide graduated circumferential compression from the distal to the proximal regions of the leg. They are used to reduce the risk of developing deep venous thrombosis by enhancing blood flow and preventing blood clot formation in the lower limbs. Question 22. What is the role of low molecular weight heparin and unfractionated heparin in the VTE prophylaxis? Low molecular weight heparin is a class of anticoagulation medication used for the prevention and prophylaxis of blood clots in patients at risk of VTE. Unfractionated heparin is preferred in patients with renal failure or when rapid reversal of the anticoagulation may be required. Both medications play a crucial role in VTE prevention by thinning the blood to prevent clot formation. Question 23. What defines a major bleeding event in the context of VTE prophylaxis? A major bleeding event is defined by criteria including this or a decrease in hemoglobin concentration of more than 2 grams per deciliter, or the transfusion of more than 2 units of blood, or bleeding into critical areas like retroperitoneal, intracranial, or intraocular sites, or a serious life-threatening clinical event, or a bleeding requiring surgical or medical intervention. Identifying and managing major bleed is critical in balancing the benefits and risks of VTE prophylaxis. Question 24. What is the role of VTE committee or task force in maintaining VTE prevention standards? The VTE committee task force is tasked with providing quarterly reports to the Patient Safety Board Committee and Regional VTE Committee. The role is crucial in ensuring that international VTE guidance is fully implemented, kept up to date, and aligned with both international standards and MOH guidance. This ongoing oversight ensures that VTE prevention practices remain at the forefront of the patient safety efforts within the hospital. Question 25. How does the medical director contribute to the VTE policy's effectiveness? The medical director plays a key role in ensuring the VTE policy's success by presenting monitoring data to the board, being responsible for the policy, overseeing its review and accessibility, and ensuring compliance through proper procedures and training. This ensures that the policy remains current, accessible, and effectively implemented across the hospital. Question 26. What are the duties of the department's heads and nursing leaders regarding the VTE policy? Department heads and nursing leaders are responsible for making sure all staff are aware of and trained on the VTE policy and procedures. They must ensure clinical staff comply with local and MOH policies, receive adequate training, and use the audit tool for compliance monitoring. Their leadership ensures that VTE management is uniformly understood and applied. Question 27. What responsibilities do medical staff have in preventing and managing VTE? Medical staff are tasked with staying updated on VTE training, ensuring thorough risk assessments for VTE and bleeding, reviewing initial assessment within 24 hours, reassessment of the risk as clinical situations changes. Also, they document all assessments and prophylaxis accurately and explaining management plans to patients, especially when deviating from standard guidelines. They play a critical role in every step of VTE risk assessment. Question 28. How do pharmacists support VTE prevention and management? Pharmacists ensure that risk assessment forms are documented, review and advise on prescribed VTE prophylaxis, and participate in VTE training. Their expertise in medication management is vital for selecting appropriate VTE prophylaxis and ensuring that prescriptions are in line with the latest guidelines and individual patients' needs. Question 29. What are the key responsibilities of registered nursing staff in relation to VTE? Registered nursing staff ensures they are up to date with VTE training, verify that all patients have been properly assessed for VTE risk, maintain accurate VTE documentation, administer prescribed VTE prophylaxis, provide patients with information on VTE risks and prevention, teach patients to self-administer prophylaxis where appropriate, escalate any omissions in risk assessment or prophylaxis, and ensure correct fitting of mechanical devices. The role is integral in both the preventive and educational aspects of VTE management. Question 30. How should hydration and mobilization be managed for VTE prevention? All patients should be adequately hydrated according to their clinical condition and mobilized as early as possible within limits of their clinical situation. These measures are critical for VTE prevention as they help reduce the risk of blood clots by improving circulation and preventing stasis. Thank you for joining us. Stay tuned for more policy reviews.